You must be wondering, this is a pregnancy card, Prega News as most of the people call it. But no, it is not a pregnancy card, it is a ovulation kit. Yes, my dear friends, I am talking about ovulation kit. Today we will discuss about what is ovulation kit, how to use a ovulation kit, when to use ovulation kit, how useful it is, what are the other methods of detecting the ovulation. Good morning, I am Dr. Rajat. I am a gynecologist and infertility specialist, and you have started watching our YouTube channel, The Fertility Gynecologist. Many people, when they come, they are trying to get pregnant. From somewhere, they get to know that ovulation can be detected through ovulation kit, and they try doing the ovulation kit at home, test at home, and then they try. Most of the people who come to me and then they are using ovulation kit, they don't often succeed. We will discuss in this video what to do, how to correctly use the ovulation kit. First of all, before doing an ovulation test by ovulation kit, you need to do what is ovulation, when it occurs, and what are the mechanism behind ovulation. A female approximately has a 28 to 30 day cycle. From 10th day, the follicle starts forming. It starts forming before, but on 10th day, it is about 10-12 millimeter size and it is visible on ultrasound. It grows at the rate of 1 to 2 millimeter per day, and between 14th to 18th day, it becomes a pre-ovulatory follicle. That means pre-ovulatory means it is about to ovulate, and the size of follicle on ultrasound is about 16 to 18 millimeter when it is about to ovulate. The hormone behind this folliculometry is important. The initial growth of follicle is caused by a hormone called as an FSH, that is follicle stimulating hormone. That grows, that hormone increases till about 6th, 7th, 8th day. The moment the follicle starts forming, it starts producing a hormone called as estradiol. So after FSH rise, then it comes down at about 7th, 8th day, and then the estradiol rise takes over. The moment estradiol reaches a critical level at about 250 microgram per ml per follicle, that is the time when LH, that is a luteinizing hormone, starts rising. And this LH hormone is responsible for ovulation. This LH peak has got three limbs. One is an ascending limb, one is a trough, the peak, and other is a trough. This whole cycle is there for about 36 to 48 hours. And the moment LH level reach peaks in the body, 24 hours after that LH peak, the ovulation occurs. So these ovulation kits at home, they detect the amount of LH in urine, and thereby it can predict when whether the ovulation will occur or not, or whether the LH rise has occurred or not. So this is the basis of doing an ovulation test. It is also called as OPK in local language, that is a Ovulation Predictor Kit. So it is like a cassette. I'm opening it for you. This is a cassette. It is almost similar to a urine pregnancy test kit. There is a well and there are two lines, one is C and one is T. C is for control and T is for test. So this is a urinary dropper. How to do a ovulation test kit? Normally we tell the patients to collect the urine and put about approximately half ml to 1 ml urine in this well and wait for 30 to 40 seconds. After 30 to 40 seconds, this control line will become dark, and test line, if the amount of LH is present in urine, then that may become either faint or dark depending upon the amount of LH present in urine. So this is how a LH test needs to be done. Now, when the LH test, this starting should be done. First of all, let me discuss about the cost. This is a costly kit. One kit is costing about 250 to 300 rupees. So when the person should start testing, when the female should start testing for LH kit, ideally they should start testing at about, if the female is having a 28 to 30 day cycle, that means ovulation would be somewhere around 14th to 15th day. So they need to start testing for ovulation at least 48 to 72 hours before that 14th day. So somewhere around 10th to 11th day, they should start testing. Now ideally, in an ideal world, they say from 10th to 11th day you test this strip for 3 times a day, but it will become expensive. You can use any type of urine, whether it is morning, whether it is evening, it does not matter. But thing is, you should not have taken too much of water before doing this test, otherwise the urine would get diluted and the amount of LH in the urine would get diluted. But because the LH, whenever the LH peak occurs in the blood, that LH to come in urine would take about 10 to 12 hours. So if LH is positive, if test is positive on this control, the test line on this OPK kit, that means LH may have started rising about 12 hours earlier. So that is the very, very important thing that one should keep in mind. How should I use it? The ovulation kit I have already discussed. How to read the results, again I have discussed. 2 lines means it is positive, and if it is positive, that means ovulation may occur within next 12 to 24 to 36 hours. Now, are these kits almost always reliable? Answer is no. There are certain things in which these kits are, say, false positive, in which ovulation might not have occurred, but still these kits give positive test. Or sometimes the ovulation the LH rise may have occurred, but these kits they do not show, that is called as a false negative. So let us understand in which cases these kits calls false positive, or in that means the ovulation may not have occurred, but still you may get the false positive. The most common is certain drugs which can lead to increase in the LH level. So if you are using an HMG contains FSH and LH both, and if HMG is being used, human menopausal gonadotropin is being used for monitoring the ovulation kit, then there are chances that this kit may lead to a false positive. False negative, like I have said, false negative means the LH rise may have occurred in the body, but this is not being shown in the kit. Sometimes the quality of kit may not be normal, the date may have expired, or the temperature and the humidity difference, they also matter to this kit. The manufacturing of the kit is important, but most important common factor which one female needs to keep in mind is that one should not take too much water before doing this, because too much dilute urine may not detect enough amount of LH in the urine, and that is why this may give the false negative. If somebody has been using oral contraceptive pills before 2-3 months, does it affect the efficacy of the kit? Answer is no, because this is cycle to cycle dependent. FSH LH rise occurs individual cycle to cycle. So if you are using OC pills or hormonal contraceptive pills before, but if you are not using in this cycle, you can always use this kit. Which is the best time to use kit? I have already told that starting from day 10 to day 11 one can start using, and if one is very sure of the date are almost 28 days, so ovulation may occur between 13 to 14 days. To minimize the cost, you can use either on 11th or 12th day, that is the day before the ovulation. Which are the factors which can affect the ovulation kit? I have again told you the factors affecting the false positive and false negative, but these kits may not be very effective in premenopausal females, in menopause, in females who have had who are using fertility drugs, for example. Even with clomiphene citrate, if it is being given in high dose, say 100 milligram, 150 milligram, clomiphene leads to increase in both FSH and LH, so it may interfere with the detection of kit. So again, in polycystic ovarian disease cases in which the LH level is chronically and tonically high, in those cases again this kit may give false positive. So in those cases we have to be a bit wary of using this kit. So are there any other methods? I personally believe that this kit should not be alone used to detect the ovulation. It can predict the ovulation, that it will occur after 1 or 2 days, but it may not exactly tell when the ovulation will occur. So along with this kit, one should also use the natural methods of ovulation. One is a cervical mucus method, other is a basal body temperature method, and last is an ultrasound follicle monitoring if the patient wants to come to a doctor. So what is this cervical mucus method? Cervical mucus means as the cycle grows from day 10 to day 11, once the follicle starts forming, it produces estrogen. Estrogen has two effects on uterus. One, the endometrium increases, and second, the cervical mucus increases. The moment that this mucus, it becomes thin, and that peak thin and copious watery cervical mucus is on the day, just a day before ovulation. The purpose of that thin copious mucus is to make so that the sperm can swim through the mucus and go to the uterus. So you can see your cervical mucus. You can do a spin bucket test between the fingers if the mucus is stretching, and if mucus is breaking, that means mucus is not thin. If mucus is stretching 8-10 centimeter, that means that is a good mucus. Also, there is something called as a basal body temperature. Again, that is a relatively complicated method. There are specific thermometers of 1 degree available, because the temperature just after ovulation it increases by 1 degree Fahrenheit, and just before ovulation it is relatively less under the effect of progesterone. So female, the moment she wakes up in the morning, before taking any tea, coffee, before doing brush, before taking any water, one temperature has to be kept beneath her tongue, and they have to daily monitor the temperature. And the moment it is usually 99.2, 99.3, and the moment the ovulation occurs, it rises at least by 0.5 to 0.6 degrees Fahrenheit. It becomes 99.6 or 100 degree Fahrenheit, and that temperature would rise throughout till the next period. That is because of the thermogenic effect of progesterone. But this is a retrospective method. This will tell that ovulation has occurred. This will not tell that ovulation will occur. But if female is doing all these three methods together, then the chances are that she may be accurate. Or else ultrasound is also a good method of this thing. We also use this ovulation kit during our monitoring, follicle monitoring, or to decide the trigger, because only on ultrasound just the size of follicle and just the size of endometrium is not the important factor deciding the trigger, that means an ovulation trigger. Along with this is if HCG, this ovulation predictor kit is positive and there is a presence of good cervical mucus, then we decide to give the trigger injections. for the purpose of IUI or for the purpose of timed intercourse. Now, what are the signs of ovulation? This is also very, very important. Any female who is menstruating regularly will have definitely regular ovulation. This is very, very important. Without ovulation, regular menstruation cannot occur. Ovulation occurs somewhere around mid-cycle, day 14 to day 18. The side on which the ovulation occurs, there is a slight mid-cycle pain that is called as mitral smirk. It is a colicky pain, maybe vary from few minutes to few hours. It may or may not occur in all the females, and the changes in cervical mucosa are also told, which occur during this. How do you know that ovulation is successful? Again, I have told you that cervical mucus becomes dry, thick, and the body temperature rises slightly, about 0.5 to 1 degree Fahrenheit after the ovulation. Ovulation pain, I have discussed, it is commonly called as mitral smirk. It does not occur in all the females. It usually occurs on the side on which the ovulation occurs. Okay, sometimes it is a vague lower abdominal pain at around the time of mid-cycle when the ovulation is about to occur. So, what is this T and C on this ovulation predictor kit? T means test, that means the test of the female who is doing, and C is the control value. In almost all the tests we do, C comes dark pink, but T comes on the variable degrees of darkness of pink shade. It depends upon the amount of LH which is present in urine. It also depends upon the amount of water the female has drunk. Ideally, in an ideal world, it should be done on first urine of the day, because that urine is concentrated. The concentrated urine may have more amount of LH in her urine. But if it is not practical, the first urine has been passed, then you can do it any urine. So can one be negative? One become pregnant even if the urine ovulation predictor kit test is negative? Answer is yes, because it is not 100% sure. Like I have said before in my video also, there are various factors which may contribute to the false negative. The kit may not be good, the kit may have expired, the kit may have been exposed to excess heat and humidity which may affect the effectiveness of kit, or sometimes the female may have drunk excess water which may have led to the dilution of urine. So how do this ovulation test work? Again, I have told they basically detect the amount of LH in the urine. Confirmatory is doing an ultrasound, or you get an LH blood test done, but again that is a costly test. Important thing is how long after the ovulation the females remains fertile. So after ovulation, the egg remains live for 16 to 24 hours. Ovulation occurs at least 24 to 36 hours after LH is positive. So if the ovulation strip shows that there are two dark lines, next 2 to 3 days, the couple need to have a planned or a timed intercourse. That is very, very important. So what if the cycle is irregular? If the cycle is irregular, say 35-40 days, can one use ovulation predictor kit? I would not advise, because A, it is very, very costly kit. B, you do not know when the ovulation would occur. The per cycle monitoring along the conventional wisdom says you start on day 10, day 11, and you keep on doing it till you get 2 lines. If the patient is having a 35-40 day cycle, then the chances are that ovulation may occur somewhere around 20 days or 21st day. Again, you are not sure, because 35-40 day cycle in most of the females signifies either patient is premenopausal or patient is having a polycystic ovary. Polycystic ovary, there is increased amount of LH in the body in most of the cases. So again, that may lead to the false positive case of with ovulation predictor kit. And if patient is premenopausal, the hormones may have started fluctuating. FSH, LH may or may not rise. You do not know which phase of the cycle you are. So in those cases, we may not advise the use of ovulation predictor kit or an home ovulation kit. It can be done on any time of the day. The efficacy of this kit is about 97%. But like I said before, if you are having very, very regular cycles, 28 to 30 day cycles, then only use this kit. To try and save the cost and to become more effective, use other natural ovulation tracking methods like basal body temperature and cervical mucus method, along with those ovulation predictor kit, to be more or less certain about the timing of ovulation. These kits or any method cannot tell when ovulation would occur, but they would tell the vicinity that the ovulation is about to occur, say within next 24 to 36 hours. The confirmatory test of ovulation is with ultrasound. That means we can confirm the growth of the follicle and the rupture of follicle. This is the most confirmatory test. And in India, follicle monitoring by a gynecologist or a radiologist is relatively cheaper than this ovulation predictor kit, because at least you would be requiring 3 to 4 ovulation predictor kits per cycle. Still, you may not be 100% sure when the ovulation is going to occur, and roughly in about the same cost, not only one can confirm with ultrasound the 100% ovulation ovulation confirmation, and you will also get the consultation of a gynecologist. This was about our two small bit about Ovulation Predictor Kit, please like the video, share the video and subscribe to our channel.